to talk about the East Mediterranean region, Egypt and Turkey. And Egypt and Turkey are bound by strong religious, cultural, and historical ties. And let me start with the lifestyle. And the Egyptian and the Turkish cuisine are very similar to each other, having a very high carbohydrate intake, especially in Ramadan, in dates, and in the Oriental. The Dar 2020 Global Survey on Fasting among adults with diabetes, when I'm going to talk about the Egyptian cohort, the number of participants were 820 with a mean age of 53 years. The mean hemoglobin A1C was 8.5, and the duration of diabetes had the mean of 9 years. While in Turkey, the number of participants was 461 with a mean age of 59 years and duration of diabetes 12 years, and the mean hemoglobin A1C was better than the Egyptian arm. It was 7.5%. When we discuss the complications and comorbidities, we find that in both, the hypertension was even the same. The mean was 47% of the diabetic population were having hypertension, and hyperlipidemia was more in Turkish population. 48% of the Turkish diabetic population were having hyperlipidemia. Retinopathy was almost the same, 8.5% in both groups. Neuropathy was manifest more in diabetic Egyptian population. 45% had neuropathy. Nephropathy, almost the same, 6% in both groups. And macrovascular complications, 22% in Turkish population compared to 8% in Egyptian population. And this is the first and important question in this survey. Did you intend to fast Ramadan this year or not? And we had more than 90% of the Egyptian population in this study had the wish to fast this Ramadan. And let me show you this in the table. And 92% of the Egyptian group wish to fast this Ramadan, compared to 47% of the Turkish population had the wish to fast 2020 Ramadan. And 5% of the cases were affected by the decision to fasting during COVID era. They did not fast due to COVID era, compared to 12% in the Turkish population who did not fast due to the COVID epidemic. Another question, a very important question: how many days did you manage to fast during Ramadan 2020? And the average was 27 days fasting in both the Turkish and the Egyptian group, 28 days in the Egyptian group compared to 25 days in the Turkish group. 72% of both groups did not take any pre-Ramadan education. Only 30% received education in the Egyptian group and 17% received education in the Turkish group. And the doctors were the main place where the patients received their pre-Ramadan education. Breaking the fast is a very important issue during Ramadan, and this question was given to the patients: did you break your fast because of diabetes-related illnesses? And 20% of the Egyptian group breaks the fast due to diabetes-related illness, compared to 11% in the Turkish group. And the mean days of breaking the fast were 6 days in both groups. And these were the medications received during Ramadan. The sulfonylurea in both groups were 26% of the medications, and insulin was given to 20% of the patients in both groups. Another question, if you had hypos, and how many days of hypos? And the days of hypos were 173 days in the Egyptian group and 15 days only in the Turkish group. And we come to a very important figure, which is 2.3% of the Egyptian patients had hypoglycemia almost all days of Ramadan. In the group with 22 to 29 days of Ramadan, we had 2.3% of Egyptian population having hypoglycemia. So the decision is maybe these patients need not to fast during the coming Ramadan, or the medication at least to be revised and to go to less hypoglycemic medication and safer medication, or not to allow these patients to fast. Another important question, did you have to break your fast during Ramadan because of hypoglycemia or not? And imagine that 35% of the Egyptian population did not break the fast during hypoglycemia, and 80% of the Turkish patients with hypoglycemia did not break the fast due to hypoglycemia. This is a very serious incident and need to be revised, and these patients need to have a structured pre-Ramadan education. Another important question is the percentage of patients who needed to attend emergency department during hypoglycemia, and found that almost 7% of Egyptian diabetic population went to emergency during hypoglycemia, but more percentage of 21% of the Turkish population went to the emergency department due to hypoglycemia, and 7% of the Turkish population with hypoglycemia were admitted to hospital. And according to our guidelines 2016, we should let the patients know when to break the fast when they are having blood glucose of less than 70 milligram per deciliter, or blood glucose more than 300 milligram per deciliter, or symptoms of hypoglycemia, hyperglycemia, or acute illness. The timing of hypoglycemia, 2/3 of the cases happened between 3 p.m. and Maghrib time in the pre-iftar time. This is expected. And let me end with a summary and recommendations. A pre-Ramadan assessment is vital for any patient with diabetes who intend to fast, to evaluate the risk, to educate the patient to self-manage their condition during Ramadan, to produce a patient-specific treatment plan. And most people with type 2 diabetes can fast safely during Ramadan with the support of their healthcare professional, and post-Ramadan follow-up is recommended. Thank you.